When patients come to us for medication, a common thing that people are unaware of when it comes to OCD, both from parents and even people who have been treating them, is dosing around the SSRI, so the selective serotonin reuptake inhibitor, which is the first-line treatment. OCD in studies have shown that patients need higher dosing. So, for instance, I'll give an example. Fluoxetine is a common medication that's also known as Prozac. It's indicated in kids with pediatric OCD. So you might use 20 milligrams, 10 or 20 milligrams in a child who has depression, or even with generalized anxiety. In a child who has OCD, you might use 60 to 80 milligrams, so substantially higher doses. And what, parents tend to worry about that, so sometimes that prohibits people from getting to high enough doses, but I talk a lot about dosing around other medications. If you have an infection, you don't usually talk to your pediatrician about the dose of the antibiotic that they're going to use. They look at something and they use a table based on weight and other factors, and they say, oh, okay, you need this dose to make sure we're getting rid of the infection. Or if you have diabetes and your glucose is high, there's a certain amount of insulin we give. And so I try to help both parents and doctors who don't treat OCD as much to really know that we're trying to hit a dose. We're not just going to sit at a lower dose for a long period of time. So really commonly what I see is they've been on Prozac 20 milligrams for 6 months and they say it's not working. I say, yeah, of course it's not. It's underdosed right now. So it's really important to try to get to those higher doses. And there are resources that you can look at that provide dosing guidelines around there's various SSRIs that we use that would give dosing guidelines for OCD specifically.